Hello and welcome to Mystic Dog Mama, the podcast for soul-led dog mamas, where you'll discover how to best nourish your dog and yourself, mind, body, and soul. I'm your host, Dr. Alexia Meller. Thank you so much for joining me today. How are you doing? I cannot believe that we are already in February. Can you? I say let's kick this month off with another fabulous conversation. What do you think? Now, if your dog has ever experienced pain, whether it's from a minor injury, from surgery, or from a chronic illness, you know just how heartbreaking it is to see them suffer and how it can make you feel so helpless. Unfortunately, it's something that we all face at one time or another. And because so many of my nutrition clients and many of you listeners have reached out to me and told me that your dogs suffer from issues like hip dysplasia or osteoarthritis, I wanted to bring someone onto the podcast who I knew could share some really insightful information on how to help your dogs and manage their pain. And today's guest was the perfect person to do just this. Today, I'm speaking with Yaz Porritt of Yorkshire Pooches Therapies. Yaz is a canine massage therapist and applied herbal choices consultant who specializes in a whole dog and whole person approach to canine pain management and support. Pain is a complex topic, and we definitely dive deep in this conversation today. It's a really special conversation where we talk about pain from a variety of perspectives, including more of the energetic and mystical aspects of how and why the body stores trauma, in addition to the more practical aspects of pain. As Yaz shares, we have to look at pain as having both physical and emotional experiences. And we have to recognize that the body keeps a score well after a painful incident has occurred. This is where complementary support, like Yaz's work, zoopharmacognosy, or Reiki, and other healing modalities can be really helpful. Yaz shares her 4 pillars of pain and how you can use these to better understand what is going on with your dog. She also shares holistic approaches to pain management and how you can support joint health and pain through nutrition. Yaz also talks about how a behavior like resource guarding might actually have a pain problem at its root, and how changes in your dog's fur direction can be a subtle sign that your dog is in pain. She also gives a rundown on what to do about the top 3 pain issues that you guys share with me: hip dysplasia, osteoarthritis, and luxating patellas. And we cover some of the most common supplements and pharmaceutical options that you might come across in order to help you to make more informed decisions. Yaz also shares her thoughts on the controversial drug Librela and on when it might not be the right option for a dog. I just wanted to preface that we did record this episode prior to the release of the recent FDA warnings about Librela. What Yaz shares does echo what the FDA found, but I wanted to emphasize that the perspective she was sharing during this episode was held before she had access to the FDA findings. As you can see, this is a chock-full episode that I know you're going to love. If you enjoy a whole dog, whole person approach to your dog's health with a spiritual touch like we talk about today, come join Stacy Renfrey of Hozo Hounds and me in our brand new Fetch membership, where we'll share with you the very same framework that we use in our canine nutrition practices to help get to the root of health challenges and get your dog on the pathway to optimal health. If you want to know more, DM me on Instagram at Mystic Dog Mama, leave a comment on YouTube, or send me a message on my website, mysticdogmama.com. Now, before we get started, can I ask you to please do me a really quick favor? If you find the podcast valuable and haven't done so already, would you please consider rating it and leaving a review with what you're enjoying about it and finding helpful for you and your dog? If you don't listen on Apple, would you consider sharing your thoughts as a comment on Spotify or YouTube? This would mean the world to me because although it may seem small, this really helps to put the podcast in front of more people so that we can continue to support one another on our journeys as Mystic Dog Mamas and Papas with our pups. And if you've already left a review, thank you so much. I am so grateful. Okay, on that note, let's go. Hi, Yaz. Thank you for joining me on the Mystic Dog Mama podcast today. I have been looking forward to this.
Thank you so much for having me. It's an absolute honour. And I know we've already been waffling for 20 minutes before we were like, hang on a minute, we're supposed to be doing a podcast. We should probably start recording this now. So, where do you want me to start? Where do you want me
Oh
to
my goodness.
start?
Oh my goodness. Well, I think the fact that we were waffling for 20 minutes is a really good sign for listeners that there's loads of really good stuff that's going to come out in this conversation. So I am excited. Well, and to give the listeners a bit of a background on why I wanted to bring you onto the podcast, you came and spoke in one of my nutrition courses all about pain. And specifically, you were looking at it was part of the module where we were looking at the anatomy and physiology of a dog and looking at the muscular skeletal system of the dog and how we want to think about that. And you just threw some things in there that I was like, oh my God, I never would have thought about like the tail of a Frenchie and how that's like creating pain further up. I mean, oh my gosh, this is so great. And I think you were just such a dynamic and wonderful individual to talk about how we not only pain, because that's we are focusing on pain, but what I love too is that you take a holistic perspective and you put those other puzzle pieces together to better understand what's going on with that dog and communicating that back to the pet parents so that they can better support the overall life, well-being, health and vitality of their dog, but also that reflects back on them too. So I love that it's not an isolated way that you look at pain, that you are actually looking at what is this telling us. So I think there's going to be so much richness that comes out of this conversation today. So thank you.
No, thank you for having me. I think that pain is, sometimes like the word pain, it's a four-letter word, but my God, is it complex. Pain is not just a physical experience, it's an emotional experience. And when we're talking about, say, dogs that have musculoskeletal disease, or they have digestive upset, or maybe they have chronic itching, or maybe they have yeasty ears, or an like a recurring ear infection, every single element of that has a link back to pain. Like, I used to get ear infections as a kid. That's painful. Having dental pain is painful. And even just me saying a dentist trip, that can cause, exactly, it causes a visceral response, because even the memory of pain is still a pain experience. Pain is a necessary evil. We have to have pain. We have to feel pain, because that's what stops us from, if we've sprained our ankle, it's a short, sharp, acute pain. It stops us from moving, because if we carry on moving, what's going to happen? We're going to cause further injury.
Mhm.
So pain is a protective mechanism. However, for us as humans and our dogs as well, showing pain can show signs of vulnerability, okay? It can be we often downplay our pain because we're like, no, 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 I'm fine. I can lift this heavy box even though like my back is, telling me otherwise. No, 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 I've got it. I've got it. Why do we do that? Because we don't want other people to know that we're painful. So if we're like that, what about our dogs? What about our dogs? Are they able to communicate their pain effectively? I mean, for me, as a pain management specialist, I think dogs are really good at communicating pain. I
Mhm.
think they're ace at communicating pain. Do you know what it is? A lot of people don't know the language that they're speaking. They don't understand. And they can kind of attribute, certain behaviors like resource guarding or lead pulling is very two-dimensional. So it's like resource guarding, I'm going to get a behaviorist in to come and work with my dog to fix that problem. When actually, I mean, obviously, we should be working with our force-free, ethical behaviorists and trainers. Absolutely, they are part of the puzzle. But it's not just a 2D image; it's 3D. Why have we got that resource guard in there? Why is that, say, item such high value? Have they had to work through pain to lean down to get that treat? Have they just been on an exclusion diet for 6 weeks on a single protein, and this is the first sniff at something new, and it's like an emotional charge as well. When how were they fed as a puppy in a litter? That will all impact into what we will see as resource guarding in front of us. It's never 2D, it's three-dimensional. There's so many more layers to it. And for me, it's about kind of peeling back those layers. And I talk a lot with my hands, and I've got like a whiteboard in clinic, and I like to kind of draw, to help explain what, how many different levels there are to different behaviors. But I think dogs are really good at communicating pain. We're just not the best at listening sometimes.
Oh, I agree with you. I don't think we're very good at listening to one another, never mind our dogs. So
Mm.
I think that's one of the invitations that dogs have for us is like, can we become better listeners? But off the back of what you were just saying, I think this might be a helpful time to talk about what are some of those signs of pain, but also of the silent pain and
Mm.
those signs like that are not necessarily quite as obvious. For example, things like change in the fur direction, that
Yes.
kind of a thing. Could you maybe talk about some of those things that we
Yeah,
might
of
not be
course.
picking up on?
Absolutely. So, when I'm assessing a dog for pain, so that could be when they're in clinic with me, that could be when I'm working online with them, I refer back to the 4 pillars of pain. So, we're looking for changes in behavior. So, that could be new noise sensitivity, an escalation in aggression or aggressive type behaviors. So, any changes in behavior, research shows that 80% of changes in behavior can be attributed back to pain. That's in both cats and dogs. Big study that's open access as well. I think there was Daniel Mills, I think it is Daniel Mills. But if you put in pain and problem behavior, it'll come up. It's a really, really big research paper. So changes in behavior. Changes in gait, so the way that a dog moves can indicate that there are abnormalities in the biomechanics. So one of the big things that I do is online gait analysis. So I work with force-free dog trainers across the globe. I've got a fantastic dog trainer out in Qatar that I work with. I've got customers in the States, Europe, UK. And basically, if the dogs are too aggressive or they struggle with hyperarousal, the vet is not going to pick up gait abnormalities in the car park walking up and down because the dog's arousal levels are going to be so high. So for me, it's about pet parents submitting footage. It's specific footage that I ask for, and I analyze it. And I'll go, okay, so we have lateral deviation of the right hind limb. So lateral means it's moving away from the body. And I'll go, right, okay, so, but now I can see that fur change up on their right shoulder. So actually, we've got a compensatory tension traveling diagonally across the body. And basically, I look at all this footage and I put it into a report. That report then goes to the vet. So the vet goes, okay, we need to x-ray here, here, and here because this is what the gait analysis is saying. So it's a tool to help get a dog a diagnosis. So that's a big part of what I do is looking at gait. Changes in posture. So a big one for me is the point of hip being higher than the point of withers. So withers is about the shoulder area. Depending on the breed, what we should be aiming for is a tabletop back, so nice and flat, right? There are exceptions. So whippets, for example, they are bred to have a natural roach, so an arch in their back. That is typical for the breed. But if we were to take that posture of a whippet and apply it to a Labrador, we've got a problem, okay? The Labrador absolutely should not be doing that. German Shepherds, they have a natural slope down. But again, just because something's normal for the breed doesn't necessarily mean that that's not okay and that's not indicative of something that is uncomfortable. So if we think of Daxies, they have those little Queen Anne feet where they stand with their front paws kind of turned out. That is something that is typical for the breed. However, that is a carpus deformity that is causing that angulation. And as they get older, that angulation will kind of the wrists dip lower to the ground. That's painful. That is painful. So posture is a big one, and then changes in capabilities. So that's one really that the pet parents are going to be able to tell me. I can't tell that from one appointment. So changes in capabilities are things like so I start giving examples. So I'll go, did they used to fly into the car and now there's a hesitation before they jump in? Did they used to come and join you on the sofa all the time and now they stay on their bed? Are they not as quick to get up anymore? It's those things at home. That's what the pet parent's going to see more of, which can be indicative of pain. So it's my 4 pillars of pain that I refer to when I'm assessing for pain. And it's just about taking all those puzzle pieces and helping the pet parent put that together, to then create what pain looks like for that dog. Because it's going to be different for every single individual. Just because the Chihuahua yelped when he was having his nails done doesn't mean that when the Labrador had his nails done and the quick was caught and he didn't yelp, doesn't mean that that's not painful for the Labrador and the Chihuahua's been a drama queen. It's an emotional and physical experience. It's emotional and physical. I read something and it said, I wanted to understand vocalization in pain. So screaming, why do we scream? Why is that? And it's an instinctual response to scream when something's painful, to make a noise when something's painful. And do you know why we do it?
Why?
We do it to warn others that there's danger. So that's why. So if we stand on something that's sharp, we go, ah, it's an acute. Sorry, podcast listeners, I just screamed. Sorry about that jump scare. But if we stand on something that's sharp, we scream, and it's an instinctual thing to protect others, to make others aware that something painful has just occurred. So when you see these videos of dogs having their nails cut on social media and they're screaming, and it's usually the pugs, and they're like, ah, ha, 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 this is so funny. I'm like, that's really not funny. I don't find that funny. Like, I've got a weird sense of humor, but I don't find that funny. And that pug is so distressed in that moment, it's instinctually trying to protect everyone else with that scream.
Oh,
How crazy is that?
that's
Doesn't
crazy.
that just gives you a different perspective instantly as to why we scream? But that was from human research. I learned that because there's just not enough research in canine pain. That's not to discredit what's out there. There's some really good papers out there, but when you look at research, it always goes, the most funding goes into humans, obviously, then it goes into horses, and then it's everyone else. It
Right.
kind of we kind of come down the ladder, don't we? So I like to go to source and look at what's happening in human pain research because they're easily 10, 20 years ahead of us in what our understanding is in canine pain. Like I had a dog in a few weeks ago, amputee, and I said, what pain relief are we on at the moment? It was 4 weeks post-op, and she went, well, nothing. The problem's solved. And I went, have you ever heard of phantom limb pain? And she was like, what? I said, watch this. So I like tickled his back to get him to stretch his back legs out. And you could see the little stump where he'd had his limb removed. You could see the muscles react. So in his head, whilst he was half asleep having his massage, he was still feeling two legs stretch. And then I was talking with the vet about it, and I was like, there's nothing about phantom limb pain in dogs. And I was like, but people think I'm crazy talking about it. But if you look in humans, phantom limb pain can go on for years. People have to be medicated for phantom limb pain, and it's so important that we kind of come back to the fact that pain can occur without tissue damage. So think of a headache. If you have a headache, that is a painful experience. If you put you in an MRI and look at your brain whilst you have a headache, you will not see any difference at all. The headache's still there, but nociceptive pain can occur without actual tissue damage. You can still have pain without tissue damage there. It's complicated, and we're still trying to understand it in humans. So, my God, we are far behind in dogs. So, this is what I waffle about. Right, I'm taking a sip. I'll go.
No, this is great. This is so great. And what you're describing about the research in pain for dogs, it echoes what we see in the nutrition space too, that it's generally like 10, 15, 20 years behind. But
Yes.
I think it's also important to remember, like we are both mammals, and a lot of the same things, like the way that we are set up, there are a lot of commonalities. So it is really helpful to look at the human side of things. But something I wanted to ask you about too, in relation to like the phantom limb, and those sorts of, I'd like to dive into some of the emotional aspects of pain too, because something that I was reading as well is how we came to better understand PTSD and complex PTSD and how that is played out in the body by actually looking at dogs, service dogs from the military that came back from places like Afghanistan and the Iraq wars, et cetera, and seeing the impact of that. I think, to your point, we underestimate the role of the emotional experience of life and the emotional experience of pain that's beyond just, oh, I went to the dentist. I mean, I agree with you. I went to the dentist and that was a traumatic experience. I've stored that. But it is so, we don't even understand how complex that is and how the body holds on to those memories too. So it's not just
Yes.
in the mind, but could you talk a little bit as well about the way that
Yeah.
the body holds the story of pain, emotional and physically?
Yeah, so instantly when you started talking about PTSD, there is a fantastic book called The Body Keeps the Score. And that book was just such a game changer for me in clinic working with dogs that are traumatized. I think the first thing is we don't get to decide what a traumatic experience is for a dog. We don't. The only person that decides it is the dog. And so the guy who wrote that book, and I'm kicking myself, I can't remember his name. It's D, I think he's Norwegian. He's European anyway. Do you know which guy I'm on about? He's got
I
glasses.
do.
I can visualize his face, but I can't remember his name.
I will leave it in the show notes because it's like Van Bessel
Yeah,
something.
Van Hessel, yeah, something like that.
Yeah.
So he started working with veterans from the Vietnam War. So when he graduated as a psychologist, who he started working with, and before PTSD was even recognized as a thing, so before post-traumatic stress disorder was even recognized as a thing, people were getting diagnosed with a psychosis. When actually he was like, hang on a minute, they're going through these really traumatic experiences and coming home like this. And when he did a lot of research, like getting these patients to kind of talk through those experiences to see what was happening with the brain when they were reliving those experiences. And when they were reliving those experiences, I believe it to be the amygdala that was like, ooh, like, you need to protect yourself, you're in danger, when actually they were in New York, they were 1,000 miles away. But reliving that memory was still very traumatic for him. So with the dogs, so I talk a lot about fascia. So this is something that you will, if you've listened to anything I've talked about before, I talk about fascia a lot. So we're still trying to understand it in humans, and I've got a lot of research from the humans, but this is what I can apply to the dogs. So fascia is the cling film of the body. It's underneath the skin. It's between muscle fibers. It's what holds our internal organs in place. It's a huge communication network. And there's three things that it does. So the first thing is it helps report pain to the brain. So it picks up mechanoreceptors. So it's the difference between a poke and a push. It has thermoreceptors in it. So if I put my hand under running water, it tells me whether or not it's warm or scalding. If it's scalding, it'll invoke a reaction to remove my hand. And nociceptors, so that's your pain. So it's big communication network to protect the body. The second thing that it does is it gives our dogs a sense of proprioception. So they're proprioceptive, so their sense of space. So if we have a dog that is very painful, their proprioceptive bubble can increase the same way that ours increases. So if anyone's ever had a tattoo or a piercing or a bruise or a broken arm, and say someone goes to hug you, you kind of preemptively shrug away a little bit from that because you're increasing that proprioceptive bubble. Why? Because it's a protective mechanism. The reason I can look at you now and I can put my hand behind my back, I can't see where it is, but I know where it is because the fascia in my back and the fascia on the back of my hand are talking to each other. And this is all something we are totally unaware of. This is just natural. This is just us being. And the same thing is happening with our dogs. The third thing that fascia does is it turns our emotional state into a full body experience. So when I get anxious, I feel it in my chest and in my stomach. If I'm stressed, I feel it in my neck and my shoulders. And if I'm angry, I'll go warm all over. And that is my fascia turning my emotional state into a full body experience. So say I've got a dog comes to me for the first time. They're aggressive, they're stressed, and they're trying to wind down. If I started messing around with their fascia, because you can get things called fascial adhesions, so this cling film that's supposed to glide between the skin and the muscle, it forms part of the locomotive kind of movement of the body. If we have emotional stress or physical stress repeatedly into an area, so say they always jump in and out of the car, you put in the same you're putting pressure into the same area of the body every single time. And if they're doing that, 4 times a day, 5 days a week, it's going to cause an issue. So that fascia, instead of gliding, it kind of gets stuck. And when it gets stuck, it gets acidic. You have to remember that fascia is a collagen-based structure, so it's predominantly water-based. If it's stuck down and that flow isn't allowed to move through that collagen structure, it gets acidic. It gets painful. So I have a stressed dog in front of me and I could go down their back and I can feel the adhesions, but the skin doesn't talk to me. And the dog's going, I'm fine. I'm really stressed right now. So it's like the emotional component of the fascia takes over. It goes, no, I'm fine. I don't want to talk about that. And I'll go, oh, okay, fair enough. We'll have a look at something else. And then as they start to relax, I'm going to go back because I can feel it in my hands. There's no course that teaches it. It's just having your hands on a lot of dogs for a lot of years. And I'll go back and then I hit on that little trigger point and the skin flickers. Big flicker. The easiest way that a pet parent is going to find those flicky spots, brush your dog. Not hard, brush your dog. If the skin does like a big shift and like a flicker, you're hitting on a myofascial trigger point. That could be an emotional trigger point, that could be a physical trigger point, or it could be both. So it's about gently moving that skin, even if you just kind of slide the skin about. And if the skin's not sliding, don't pull it. It's like giving your dog a Chinese burn. You have to be very, very gentle and work within the physical and emotional point of mind within that skin. So for me, when I've got dogs that are, say they have an aversion to intentional touch. So I can go, oh, it's a little love and give them a little fuss. So they go, oh yeah, this is really great. And then I go, can I have a little, little look in your shoulder? And I go, oh God, no, you've changed it. You've changed your intention. It's that shift in energy which can uproot emotional things because they're going, hang on a minute, we've played this out before. I've gone to the vets and they were really nice and they gave me a sweetie and then they completely removed my agency. Head was facing that way and I was, my legs were pulled about. I'm waiting for you to do that. That's an emotional memory held within the tissue. I also find as well when I'm doing the massage work or the myofascial work, there's a lot of deep releases. And you can feel it. You can feel like that energy shift in the dog. But also I'm trained in applied herbal choices for animals. So I work with hydrolats. Every session has hydrolats. I've got my own brand of hydrolats. So I'll go, right, okay, what do you want to work with today? The amount of dogs that pick geranium. Geranium is it's a big hormonal regulator, but a big emotional regulator. So if they smell geranium and go, oh, I go, okay, we don't want to talk about feelings instead. That's cool, that's fine. Or sometimes they'll go, oh, actually, I really like the geranium. Can I drink some of that? Yeah, of course you can. I've got 2 water bowls in clinic. One of them's plain water, and one of them's water with a drop of hydrolat in. So I go through my diary and go, who have I got in today? Oh, we've got some big feelings in today. We're going to go with geranium, and I go, oh, if it's really hot, I tend to lean onto peppermint because it's nice and cooling. So they've always got that choice. But yeah, geranium. So the dog will be working with the hydrolat whilst I'm working. It's about creating different support networks around the dog whilst they're working. To talk about pain is to make yourself vulnerable. When you are painful, that can make you feel really unsafe. So for me, it's about kind of communicating to the dog, you're safe in this space. You can opt in and out at any point. They're not tethered, they're not stood, that however they want to be. That could be lied down, sat down, looking at mum, looking at me, stood up, whatever. But they have to know that if they go, oh, I need to move and stand at the other side of the room to just process for a minute, you have the space to do that. That's okay. That's absolutely
I love
fine.
it. I love it. I love it. I love it so much. And I know there's a couple things I want to touch on with that and ask you about this, because I know that you are also trained in Reiki, as I am as well, into the energy healing side of things. And I also wonder, are you familiar with the Emotion Code by Dr. Bradley Nelson?
Nope, writing it down though.
Okay. He was a human chiropractor who started to notice that there was a correlation. And again, this is slightly different in terms of like the humans could communicate. He could ask things and they could communicate things back. But he started to notice this connection between different emotional experiences and the way that the body was physically holding them in particular places. And there was a pattern with which emotions were held in different places. And ironically, because I'm interested in TCM, I've seen that there are some correlations between the way that TCM talks about emotions being associated with particular body systems. And he was noticing a very similar kind of thing from a Western perspective, but he uses a process of kinesiology, where you are basically working with the subconscious mind. You're bypassing the conscious mind to then release some of these emotions that are being held. So that would be muscle testing. So people who are not familiar with, like, what is kinesiology? That's where you use things like muscle testing on a human and you can, but the thing is, you can do this by proxy with dogs. What was super interesting for me, to your point as well, of the way that the dog is holding it, when I was having, so, and again, from that holistic perspective, I was having health challenges with my dog, Lucky. And one of the things that he was showing was blocked anal glands. And I was talking to the vet about, is there some, I've researched silica as an example. Can I use some silica to help him? And this was prior to me really understanding what I understand now with the nutrition. I was green with this. I said, can I use some silica to help him release? And she said, yeah, did you know that there's a homeopath in town? And I didn't. And so this is while I was in Mexico. So I go down to the homeopath and I said to him, is there any chance that I can pick up some silica? My vet suggested I talk to you. And he said, yeah, but can you tell me what's going on first? And then I'm desperately searching for, like, the Spanish words, like, how am I explaining? This is for my dog's anal glands. Like, it was just like the weirdest conversation that I had to have. But what was great, I credit him to this day that the way that he approached me with this was just so brilliant. And he asked if I could come and sit on the table and he could work with me as a proxy for my dog. And I noticed that one of the things he had me do was I had to sit with my heels hanging over the edge of the table, and he took both of my heels in his hands and he was balancing them just like this, like back and forth, back and forth. And he was muttering to himself, but I caught some of the things that he was saying. And I was like, I heard line A, I heard line B, sorry, line 1, line 2, column A, column B. I was hearing these different things. I was like, that's the emotion code. So what he was doing was using my connection to my dog as a way of trying to understand what was going on with him. And he said to me, he's holding on to fear and worry from when, and he was able to ask when these emotions got trapped, what time, like in terms of months and years in his life, that kind of a thing, from him being a puppy. And the history with Lucky is his mom was killed when he was 2 weeks old, was hit by a car. And then he and his siblings were adopted out. He came to me. The owner was trying to keep him, and then we went into lockdown, and he was leaving and couldn't keep him. So Lucky has this history of abandonment, which was one of it. Fear, which is why he was showing kidney issues when he was younger. Just amazing things. So in reality, when I started to address supporting the release of those emotions, and not from this perspective that I think in kind of Western Reiki, we're sort of taught, I'm going to heal, right? Like I'm going to power this healing energy onto this animal and get rid of it. But in reality, when you look at the history of Reiki, it's a self-healing practice. First and foremost, you need to come into that safe energetic space with yourself. Absolutely. And extend that space so that your dog can choose to come into that and do what's called coherence. They come into coherence with our energy field that lets them, which is exactly what you're doing with the kind of space that you're setting up and providing all of those different touch points of safety for them.
Yes.
It's creating that space where they can then choose, oh, okay, I'm feeling okay with this. I can start to relax. I can start to open up. And that's where the healing process can actually begin, versus I'm going to try and get rid of this emotion. I'm going to try and that way everything's going to be great in our relationship and you're going to feel great. It's like, actually, it's not that, but understanding the complexity of the way that the body stores it. Lucky was not even conscious that he was storing those emotions. Yeah. But then our job is to create that space where they can kind of come out. And I wonder what your sort of take on those more modalities, yeah, go ahead.
Yeah, I think this is a part of my job that I don't get to talk about a lot. Usually this is interesting. So with the when I first qualified as a massage therapist, so I'd be working with a dog, and I'd be say running my hands over, and this is something I've always done ever since I was a kid, and my vision would go. It would be like, when you're trying to get a camera to focus.
Mhm.
And it was like my eyes went out of focus. I'd go, what was that? And then I'd kind of carry on and it'd do it again. And I'd be like, that's so weird. And I ended up going on this course, and it was a muscle testing course. It was during lockdown, and I was desperate to keep my brain active. Muscle testing course. So the tutor starts talking about muscle testing, and then she started talking about energy. I thought, oh my God, how have I managed to land myself on one of these courses? What an, oh, for God's sakes. Right, well, I paid for it, so I'm staying. So she started talking, and then she went, so when you connect with the animal and you're running your hands over the animal, you may find that when there's a disruption in the animal's energy in their body, you are a vessel and you will feel that disruption as well. And I was like, oh yeah, all right, okay. And then she went, sometimes your eyes might go out of focus. And I was like, what? What? So I put my hand up, it was in a Zoom call. I went, sorry, can you just go back to the bit about the eyes? And she went, yeah. She was like, she was like, energy is a transfer. So you transfer energy all the time. And she's like, when there's a disruption in the animal, that energy disruption will come into you, and that can present itself with your eyes going out of focus. And I was like, oh my God. I was like, thank goodness I'm sat down. Like this is earth shaking for me. Like this is something I need to look at. So that's kind of where my journey began. And I was like, actually, I need to look at energy work more. This is something I've inadvertently been doing for years, and it's happening more and more with the dogs that I'm working with. So it started where I can feel heat in certain areas without touching the dog. Could that be just my thermoreceptors being extra sensitive? Yes, it could be, but actually, it's emotional stress that the whole dog. So, dogs that are stressed or anxious, they carry it in their neck and in their shoulders. And I find that if a dog's lacking a lot of confidence, they hold that in their lower abdomen. I don't know why, but that's what I see. They hold if they hold a lack of confidence, it's kind of like that root chakra sort of area that they hold that lack of confidence because that lack of grounding. And so most of the time, I mean, probably half my customers don't even realize that I'm doing this. But when I'm talking to the customers, I'll get them flowing, get them talking. Because if the owner comes in and they're really, really wound up, that's going to affect the energy flow in the room. So I'll go, right, okay, tell me about your day. What's been happening with work? And as they start to offload, I just let the words kind of swirl around at the top because I'm working with the dog, because there's the owner, their vibrational energy drops. The dog goes, oh, I can relax as well. And I get so much more out of the dog. It's 50% about the dog, 50% about the pet parent. So I remember, I was working with a dog, and the dog was like really fizzy, and I was like, this is an emotional thing. There's something, we're unsettled at the moment. Pet parent was unsettled at the moment. So I just got my hydrolats out and I was like, oh yeah, yeah, whilst he was talking. And I just put them by the armchair that he was sat on. And I carried on working with the dog. And he starts telling me all this stuff. And then he goes, I have no idea why I'm saying this to you. And I was, he went, what have you done? I was like, nothing. I've just changed the energy in the room. And he was like, what's this witchcraft down here? I was like, this is some hydrolats for you. And he was like, I can't believe you've done that. And he always takes the mick out of me every time he comes. But he's always like, we always end up having these really kind of deep conversations. And that's just me wittering. I mean, anything that I say to any kind of human advice I give, it's off the bat. Whereas anything I say about the dogs is from years of research. But the energy thing, I can't explain it. I don't want, like, there's obviously I've done the Reiki side of things, but there's things that I can't explain when I'm working with a dog. So sometimes it's like an overwhelming, it's almost like a message or something, and it goes, they need a little bit of something here. So I'll just stop. And it's not about the dog taking energy from me. It's like a channel.
Yeah.
I'm just a channel to transfer that energy
Yep.
into a certain area. I mean, I've done I mean, this is really, really separate from kind of what I've done with Yorkshire Pooches Therapies, but I work with a lot of palliative care dogs. So dogs that are kind of coming towards the end of their life. And there's certain signs that can indicate that they're getting ready. So there's physical signs that they're getting ready. But there's also massive energetic signs. So you will start to see, or you'll start to feel a shift of energy around that dog as they're getting ready to transfer from this astral plane to another astral plane. They're getting ready for their next step in their journey. And I've been very, very honoured and very privileged to work. I'm sure his mum won't mind. So I was working with a dog, and it was, it was time. He was 12 years old. And I always have a thing that for any dog that comes to see me in clinic, if there ever comes a day that the dog can't make it to me, I will come to them. And that's what I'm getting goosebumps. And that's what I like to do I love you. Thank you for allowing me to be part of your journey. And I'm here to support you as you get ready to make that next step. So I went out to see this dog, and this dog, it was, oh my God, it was just always so full of life. He was just hilarious. He never got the memo that he was 12. But I went in and he was laid on his bed, and I was like, oh, okay, all right, he's tired. He's tired. And his mum was like, he's just like this all the time. I said, this is okay. This is all right. Like he's getting ready to leave this vessel. And he's just turning all the lights off, switch it, unplugging stuff like this is okay. And I used Reiki. I used pendulum on the right. So I was like, right, I'm just gonna have a look at his energy centers. Now he had cancer. It was cancer in his was it his spleen? And like so his solar plexus, the pendulum just stopped still. And I was like, that's okay. We know why that stopped still. And then I went up. And his crown chakra, oh my, and shit, why is it doing that? And I said, he's connecting, he's getting ready. That's what that is. And his throat chakra just wasn't open. And this dog barking dog, always talking, always had something to say. And I said to her, he didn't bark when I came in. I was like, he hasn't barked for the entire time I've been here. I was like, but look what his throat chakra's telling us. I was like, it's shut. It's not, I don't know if you do this as well, but I imagine energy centers as spinning wheels, and they're all kind of like interlocked with each other. I was like, if this one's not moving, this one's moving too. I was like, we just need to realign what we can. And he was in a very, very deep kind of meditative state. Mum was there, her daughter was there. I've got a particular selection of incense that I have, which is used for enhancing spiritual abilities. I had particular crystals around him as well. And I said to her, if you feel comfortable, I did a course about shamanic journeying, and part of that I learned, I don't even know what you'd call it, like a chant, and it's a chant to call upon your ancestors. So I said to her, are you comfortable with me doing this? Like her daughter was quite young, and she went, yeah. And I didn't bear in mind this dog was half deaf, and I didn't even like open my mouth to do this chant. You start kind of like down here, like deep in your throat. And he literally lifted his head up and he looked at me. And I said, like, I looked at his mum, like, afterwards. She was like, no one will believe us. No one will believe us that happened. I said, it doesn't matter that no one's going to believe us. I said, he was here. I said, he could hear. She said, how could he hear? And I was like, I said, because someone's gone. Someone's here for him. They're ready to take him. And then the next day, the vet came out and they did what they had to do. And I said to her, hold ceremony for him, light a candle, light some incense, just be with him, be present. I was like, he's so ready. He's really, really ready. I was like, he's got 1 foot here and he's got 1 foot over there. I said, you're just helping him. I was like, you're just opening that door a little bit further. I said, everyone who he needs is waiting for him. I said, and they'll welcome him. And she said it was really peaceful. I get really emotional talking about him, but it was very, very, it was an honor. It was an honor to be able to do that. I don't know what the hell I was doing, but it just intuitively felt right. So it's not something that I ever talk about. I never talk about this side of my work because I think I don't know, maybe because I don't have a piece of paper that says I can do this. I don't like to tap into that side of work. But when that time comes, like people know I'm, witchy and I'm into the, I mean, look at my hair for God's sakes. The signs are there. The signs are there. There's crystals all over this building. The signs are there. There's moon water on the side. The signs are there. But it's I never want to make anyone feel uncomfortable, but it's kind of a just so you know, this is something that I do. Animal communication's a big part of that as well.
Mhm.
So in this building, I always say like, well, at home, like in this house, we narrate the dog's thoughts. Like, and you run into that kind of risk, don't you, of anthropomorphization. Do you know what
And,
I'm trying to say? I
and
never pronounce it correctly.
anthropomorphizing. Yeah, it's a tongue twister.
Yes, that's it. It is, isn't it? But I think that in some instances, when I'm in clinic and the energy's right, I can hear.
Mhm.
I can't explain it. I can't explain it, but I can hear what they're saying to me. And I've always had a stronger affinity with animals than what I have other people.
Mhm.
And I just think that they're really good at communicating. It's not a case of a dog comes in and goes, "Oh, this leg's really hurting me." It's not like that. It's a different language. It's I don't know what it is. I don't know what it
It
is,
is.
but I say I can hear you. I hear you. And it's when we get to those palliative care stages, I find that pet parents are a little bit more open to listening to that sort of talk
Mhm.
about stuff. But that's so I've got a separate business called Instinctive Animal Wellness. So that's where I talk about my crystals, and that's where we talk about herbs. And I have to keep the two separate because otherwise, if the vets found out that I was doing massage and a touch of Reiki, they would absolutely lose their mind. Like, so from a business perspective, I have to keep them separate, but not really.
Right.
On a
Right.
on a commercial front, they're separate.
Right.
But it's still me in both businesses. It just depends which business you want to tap into,
Yeah.
which will facilitate how much I talk about stuff like this.
Right. Oh, thank you for sharing that, Yaz. That's just
No.
beautiful. Oh, I love it. I love it. And I think something I want listeners to take away from that too is that everyone is already doing this. We are energetic beings, right? And so to your point of like not having the certificate, that whole certificate nonsense, to be honest, that it's just totally made up, right? It's
Mhm.
all of it is made
It
up,
is.
right?
It is. Yeah, yeah. It is.
And that's not to say that you can't learn. And I think, like I was saying, something like Reiki actually, when you go back to how it was originally taught, is so different from that translation to the Western context. And so much
Mhm.
about that, the Western context is like doing it in a weekend and getting your certificate, and then you're meant to go and be a healer. It's like, no, it's it's asking
Mhm.
you to come into more resonance with yourself. And in doing
Mhm.
that, you embody that, whether you want to call it source energy, chi energy, which is what Reiki is, right? Like that you
Mhm.
are more connected with that. And it's not, I shouldn't say it's more, it's not that you're more connected, you're more conscious of your connection to it.
Yes, because we're all connected. We're all
Well,
energetic beings. Like,
all of us.
like a weird. Well, it's not a weird thing, but it's. I clean the room in between appointments. I clean the energy of the room.
Yeah.
I have a sound bowl. I have to clean the energy of the
Yeah.
room because sometimes it's a very emotive space. You're talking about someone's baby
Yeah,
being painful. That's upsetting. So
absolutely.
it's important that the room is cleaned in between sessions energetically.
Right.
Um, because you don't want that, because energy is all about transfer. It never disappears. We're transferring
Right.
all the time. So yeah, I clean the energy of the room, and I can't remember who I was talking about this with, but as a woman, this kind of um hiding your abilities, almost like a shamefulness around it, is your witch wound.
I was just gonna
It's
say
yeah.
the witch wound.
It's
Yeah.
because generations ago we will have
Yeah.
been persecuted for these abilities that we have to connect energetically. So it's like this shame. It's a shame around it. And
100%.
you don't have to be ashamed, you don't have to be ashamed about it, but I'm very careful about who I talk about it with
Yeah.
because I don't want it to discredit the other work that I'm doing, which is very much scientific backed. But you can be scientific backed and believe in energy. It's not even a case of believing in energy. Energy is there whether or not we believe in it or not. It's
Right.
there.
Exactly. And the thing is, science is starting to catch up to these things. But I love as well that we're recording this on the day that Pluto enters Aquarius. We are now in the age of Aquarius, which is this paradigm shift. And Aquarius is all about power to the people, about
Nice.
recognizing your own power, coming into your own voice. So to that, and I think that's why a lot of the witch wound stuff is coming up in a variety of ways, whether or not you're
Yeah.
labeling that. But I think we're being called into our power. And we also know that a lot of health challenges, even when you look at it from a TCM perspective, which has thousands of years of scientific data around it, thousands of years of tracking these correlations, when we repress emotions, they create stagnation, physical and energetic stagnation in the body, which leads to disease state. So we
Yes.
know that there is a link between all this. So I just think it's beautiful that we're having this conversation of like freeing the energy, freeing our voice. And when we do it, we can help our dogs do the same because we can create
Yeah.
a safe space for them to be releasing their pain, their emotions. We can recognize it, we can hear it. And again, it's the invitation that they are showing us we need to listen to ourselves. We need to become better listeners generally,
Yes.
which I just love. So thank you for talking about the witch moon. That's one of my favorite things. But I did want to touch on, I wanted to pick your brain because you're the perfect person to pick on some of this stuff too.
Yes.
Around listeners write into me about their kind of top issues when it comes to pain with their dogs tends to be hip dysplasia. That's a common one.
Yeah. Yeah.
Osteoarthritis and luxating patellas, particularly in our smaller breeds. And I wondered if you could
Yes.
kind of touch on what's going on with some of those. And what are some ways that we can both prevent that, if that's possible, and how can we help support the pain with those issues in a more holistic perspective, not only from natural kind of herbal aspects, but also from that holistic perspective of how do we support the environment for the dogs?
Yes. Okay. So hip dysplasia, that is, so the hip is a ball and socket joint, and hip dysplasia is an umbrella term for disruption somewhere in that joint. So you could have a nice socket, but you could have your femoral head, so the top of the femur, thigh bone, instead of being nice and round, is flattened. So it's not going to succinctly fit in there. It's going to get uncomfortable. We have some cases of hip dysplasia where the top of the femoral head is perfect, but the socket is too shallow, so there's no anchoring for it. What I would say is that if anyone has a dog that has mild hip dysplasia, just because it's been diagnosed as mild does not equate to it being a mild experience for that dog. The only person or being that gets to determine how painful it is the dog themselves. So if they go, oh, it's mild, it's okay, you can just manage it. It's dog to dog dependent, okay? So with hip dysplasia, the best things that I'd recommend for that underwater treadmill is fantastic. It is controlled. We're building water in warm water. It's very important. It's warm water. You can build muscle mass a lot quicker in water than what you can do land-based. Obviously, I'm going to be biased, use soft tissue therapies, so myofascial stuff, because just because you've got hip dysplasia doesn't mean that the pain is just in the hips. You can have compensatory tension traveling up into the shoulders area. You can have discomfort in the stifles as well, because what I see a lot is, say, for example, your bigger breeds, so golden retrievers, they will have a diagnosis of hip dysplasia, but then as a secondary, they have a low grade of luxating patella. And sometimes the patellas kind of get ignored and it makes them really cross because the stifle's one of my favourite joints, which is weird. Every therapist you talk to will have a favourite area to work on, and the stifle is my favourite area to work on. So with luxating patella, that is basically where the kneecap is coming out of the trochlear groove. So it's coming out of that house, so that dip in the femur, it's coming out of that. And it's graded 1 through to 4. Grades 1 and 2, you can manage really well conservatively, especially in our smaller dogs. But the smaller dogs tend to have the higher gradings. So they have gradings 3 to 4. You've got to have surgical intervention. There's no amount of food work, therapeutic work, or anything that's going to fix the foundations of that. However, there's a lot you can do to prep them before surgery. So starting massage or physio or underwater treadmill, build up that muscle mass, because when they go in and surgically correct that joint, we lose a lot of muscle mass when we're resting, but if we've bulked up before, it means we're not losing quite as much, okay? And we've still got something to be working with. So, pre-operative care is just as important as post-operative care. The smaller dogs, they do tend to cope pretty well with luxating patella, but I don't like the word cope, because are they just used to being in pain? Potentially. So like little dogs, I'm thinking Jack Russells, I'm thinking Chihuahuas, and they've got hearts of lions, and they think they're really big and hard, and they think they're the size of a German Shepherd, and they carry themselves with that energy, right? Do they carry themselves with that energy because it's a protective mechanism, because they are prone to hereditary issues such as luxating patella? Just makes you think, doesn't it? It makes you think. So just because, the dog copes well on three legs doesn't mean that it's not uncomfortable. We have to remember that dogs very much live in the present, and they wake up and they go, oh, that's really painful. That sucks. I guess that's what my life looks like now. They don't understand that tomorrow that could change because mum and dad have gone and picked up pain relief, or they've started TCM work, or they've looked at nutrition. I think the most important thing with any orthopedic condition, hip dysplasia, luxating patella, osteoarthritis, the most important thing is keep your dog lean. You have to keep them lean. Adipose tissue, which is your fat tissue, produces adipokines. Adipokines they mimic inflammatory markers. So you're getting inflammation from fat tissue on a chemical level, but you're also getting additional mechanical pressure into an already painful area because of the additional weight that's on the dog. So keep them nice and lean. That's the cheapest, most easiest, most effective supplement you will ever give your dog, is to keep them lean. If you're concerned about your dog's body condition, speak to your vet nurse. It's not a case of looking at that poster on the wall sponsored by a hideous company and saying, oh, my dog is a beagle, therefore they should be this way. What those posters don't take into account is height, bone density, and muscle mass. Having someone be hands-on with your dog is the best way. So don't get tied up too much on the scales. Have a look at how the dog is feeling. That's like my most favorite thing, is teaching pet parents how to body score their own dogs. I think when I'm talking about any kind of joint disease, so osteoarthritis, inflammatory is an inflammatory joint disease. If you have hip dysplasia, it's not a case of if we get OA, it's when we get OA. Osteoarthritis is caused by either abnormal forces into normal joints. So abnormal forces could be things like if you compete in flyball or agility or dock diving or anything like that, it's an excess amount of abnormal forces into a normal joint, so that can cause arthritis. Or it can be normal forces into an abnormal joint. That's what can lead to arthritis as well. So with all three of those, obviously we know that inflammation starts in the gut. Everything, it all starts in the gut, right? So my three kind of kingpins for joint health or managing inflammation is, are we hitting our omega-3s? Are we getting in enough omega-3 fatty acids? Also, where are we getting it from? Are we getting in EPA, DHA, or are we getting in ALA? So are we getting fish source-based omega-3s or plant-based source omega-3s? If we've got a dog that cannot tolerate fish, so for example, Dalmatians, they can't have purines, so obviously they can't have the fish. How are we hitting that omega-3 content? Algae oil, absolutely phenomenal for plugging that gap, right? If we look at why green mussels are so good, what are they eating? Go to source, they're eating the algae. There is research to show it's not the best bioavailability with alpha-linoleic acid. You're looking at about, I think it's either 2 or 5%. It's very low percentage bioavailability, right? But if that's the only way we can get omega-3s in, stick with your alpha-linoleic acid-based omega-3s. So omega-3s is your big one. What are we putting in that is a potent anti-inflammatory? The easiest one is chamomile tea. It's my most favourite one to recommend as well. So easy. You can pick it up at the supermarket, right? Make your dog a cup of tea. My dogs are obsessed with drinking different teas depending on what time of year it is. I've created little beasts. I can't have a cup of tea without the dogs trying to get involved. So have a look, see if they fancy a little cup of chamomile tea. Obviously, make sure check on the inside of your wrist. You know, they can't drink it like straight out of the kettle or anything like that. If it's safe for a baby sort of temperature, safe for the dog. And your third thing is your collagen, glucosamine, and chondroitin content. They're your building blocks for your joint health. Bone broth. Easy peasy. How easy peasy is it to make bone broth? But it's not just, it's not a case of, oh, the building blocks are damaged here. I'm going to give my dog bone broth and it's going to rebuild it. It's not like that. We can't cure an orthopedic condition. We can help manage it through nutrition, though, and slow down the progression of that joint degeneration, but also looking after the microbiome. Looking after the microbiome is so, so important. And we'll be here for another 5 hours if I start talking about that. But I think it's 98% of the body's serotonin is made in the gut. Serotonin is your happy chemical. When we look at pain, it's physical and emotional. If we have a positive outlook, it will change the outlook that we have on our pain as well. So it's all multifactorial. And as well, like, don't be afraid of pharmaceuticals either. That's another big one for me. I have a lot of painful dogs that come to see me, and they do amazing with the natural stuff and the support of pharmaceuticals as well. If we have a dog that is on NSAIDs because they're end stage osteoarthritis, it becomes a welfare issue if you are not managing that pain correctly. It's not liver and kidney disease that will take them. It'll be the fact they can't stand up anymore. That's what will take them. So it's about, okay, we have a dog that's on NSAIDs, long-term liver and kidney damage is a possibility. What can I do to support the body whilst on them? Supplement with liver and kidney. Like for me, that's for me, support it as much as possible. Obviously, if your dog is on any regular pain medication, they should be having blood tests every 6 months minimum, just to check how everything's ticking over. There's only so much that turmeric paste can do. I think that, as much as I love it, I do love it. I think sometimes it can be almost overused, overhyped sometimes. You can't out supplement a bad diet. You can't out supplement pain relief. It's absolutely has its properties. Have been a very, very potent anti-inflammatory. But is it the right one for your dog? Have you ever tasted turmeric? It's not the best.
Well, no, and from the TCM perspective too, I bang on about this quite a bit too, that turmeric is a hot spice. And so that's not going to work for warm dogs. In fact, you're going to push them into disease state where inflammation exists if you keep feeding it to them. And also, I was in a group that was hosted by an herbalist who also did a lot of work with Kate. Her focus was on dogs, but she was a human trained herbalist. And somebody had put in about when they were feeding their dog turmeric, they got like a kind of funky smell. Yes.
They stink.
They're intolerant to turmeric. It's a sign of intolerance to turmeric. Because I noticed, I used to give golden paste to Lucky, and he hated it. But I was like, "This is good for you. I'm going to give you this." And he ended
Mother knows best.
Oh, right, exactly. God, but
it's on the back of their neck.
They
stink like a cat wee. It's
like
the weirdest thing.
It's like a cross between cat wee and like a teenage boy is what I was describing. It reminded me of like my brother going through puberty of like, oh God, just that kind of thing.
That awful fussy smell.
That can be a sign that the dog is intolerant to it. Yeah. So it isn't great for every dog. So you do have to look at what's right for you. But before it gets to kind of, they need the NSAIDs, what are some things that they can be giving for pain management from a more kind of natural perspective? What do you like to recommend?
I like omega-3s. You can't have enough omega-3s. Obviously, keep your variety is key. Just be careful about where you're sourcing your omega-3s. I'm not the biggest fan of fish oil.
Right.
I like to feed whole food sources. The less we've messed about with it, the better. I really like as well, this is a little bit of a controversial one, but I really like sweet potato. The reason for that is that sweet potato contains something that helps with the production of hyaluronic acid in the body.
Mhm.
And the hyaluronic acid is something that can be what's the word I'm looking for? Can be lacking because of joint disease.
Mhm.
So, and as well, it's an insoluble fiber. Again,
Mhm.
what's it going to be doing? It's going to be keeping that gut bacteria happy. It's, it's super easy to access. Well, for in the
Mhm.
UK, it's super easy to access. I think sometimes that carbs can get demonized a little bit, but it's dependent on the type of carbs you're feeding.
The type of carb and your type of carb and your dog. So like a yeasty
Yes.
dog, I'm not recommending
No, God,
stew,
no.
right? But if
No.
you're or a diabetic dog, same thing. But so that's where
Yeah.
it is looking at the dog in front of you and trying out and
100%.
work with them. Yeah.
It's like with
Mm.
with my dog Lily, she has a history of anal gland problems. She's been raw fed since she was about 1.5, and we had to move her on to cooked. That is the only
Yeah.
thing that I could get her stable on,
Yeah.
and she needs a lot of fiber in her diet. So she has a really nice, lovely cooked food brand. Whereas my Romanian rescue, she can't have any veg. She cannot have any veg. She's just prone to itching at the drop of a hat.
Mhm.
Anything can kind of set her off. I mean, God knows what she was eating on the streets of Romania, like rotten like chicken wings or something like
Mhm.
that. But I bet her gut microbiome was really good and really robust.
Yeah.
But she cannot cope with veg content, which makes you think, well, will she have had access to complex carbohydrates on the streets of Romania? Will she have had access to lightly steamed broccoli? No, she will not have had that. So her body just can't tolerate it. Whereas Rodney, my other dog, I can just give him anything. Give him absolutely anything, cooked, raw, whatever. So she's on raw but can't have any veg. Lily's on cooked and has to have a lot of veg. And Rodney, he has to be on very like high fat diet. He's a nervous energy dog. He's like like a high vibrational energy all the time. So I have to put a lot of energy back into him because he
Mhm.
just burns it off so quickly. But yeah, it's very much looking at the individual dog. Like if I gave Peggy sweet potato, oh my days, like get ready for hell. Like
Right. Exactly. Exactly. What are your thoughts on something like PEA? That comes up quite a bit in conversations and CBD oil.
Ooh, okay, right. CBD oil. So this is really interesting. In the UK, there is not a single licensed product for CBD. There's not one. Not one licensed for pets, okay? The reason for this is because we don't yet understand fully how dogs metabolize it.
Mhm.
Therefore, we cannot accurately dose CBD oil. The thing with CBD oil is the THC content, so the stuff that makes you go, ooh, when, if you've ever dabbled. And with the THC content in CBD, it's a lot higher than say hemp seed oil. We can get the same
Right.
benefits with I think it's 0.006% THC in it. It's pretty much it's from the same plant, but it's a different part of the plant.
Mhm.
So we're removing that risk of the dogs being exposed to THC. Is it a bad thing if they're exposed to THC and it makes them go a bit woo? No. Is it ethical? No, because they can't rationalize why they're feeling woo.
Mhm.
Okay. Um, so I do really like CBD oil, but it's at the moment in the UK, it's not something that the VMD will even acknowledge
Mhm.
as because we don't understand how to dose it. The only way that I would recommend CBD is if you go to a vet who knows how to prescribe CBD and they've got a particular brand because there's so many different brands. Whereas with the dog market, I recommend hemp seed oil because that's what I can safely recommend at the moment. Of course, I'm hoping that will change because the benefits of CBD oil are very well known. But again, we're 10, 20 years behind.
Mhm.
Yes, we're built the same and we're made up of the same, we're the same on a cellular level, we're just put together differently, but we metabolize things differently.
Differently.
And that's the big thing with CBD. So I would say if you're looking to get CBD for your dog, you need to find a vet who has a specialist interest in CBD. They're the only ones currently in the UK who can prescribe it. If you don't have access to that, there is a hemp seed oil company called Voyager that are based in Scotland, and that's the hemp seed oil that I currently recommend. Really nice, clean sourcing, and they play by the rules. If you look, there are CBD products on the market for dogs,
Mhm.
but it's not licensed.
Okay.
So just be safe. Just be
Right.
safe with it, So love CBD. We need to know more about it in dogs before it's commercially available in the UK. And PEA, I'm hearing good things, but I don't know enough about it yet. I'm a little bit of a dinosaur. I'm like, oh, something new. No, I'm going to stick with my omega-3s. I'm going to stick with chamomile that's been used for hundreds of years. I don't know enough about it to have an opinion yet. What's your opinion about it?
Well, I feel a bit the same way. The people that I'm looking to towards it, like Dr. Judy Morgan recommends it quite highly. So I'm kind of going down that route of exploring. But I agree. I am not somebody that knows that much about specific pain management in terms of, so I always would refer to somebody like you, for example, that knows much more about pain, because I think, again, I can work with things from the more the nutrition and the nutrition supplement kind of thing,
Yes.
but not specifically about that question of, will this solve my dog's pain problem? And again, that's where I would work with somebody like you with it. So if I have a nutrition client, I would bring you on to have that conversation around, this is what's going on with this particular dog. This is what this dog is tolerating and not tolerating. In light of this, what might you suggest? For example, we're already doing this in this way, or like if I had a dog that couldn't tolerate veg, for example, like that gives us an indication of what we can do, kind of in other areas. But it's something that I'd like to educate myself more. And the same with like CBD. I don't know enough about it to be able to give a.
It's very, very good for humans, 100%. Like, I know that it's good in humans, but I can't safely recommend it at the moment. That's the thing. Just because we metabolize it differently.
Exactly.
And
exactly.
I need to learn more about it. I 100% need to learn more about it. So I'm a bit of a dinosaur. Like, it just takes me a little while to come around. Like, if something gets a lot of hype, I'm like, where's the research?
But that's what I like about your approach. And we were talking, but it's true. I mean, we can talk about the witch wound, which I love, and but also like the evidence base, because I'm the same way. It's like I want to see both, and then be able to present that information to the client to say, it's ultimately your decision, but here's the stuff for you to make the decision that feels the best for you and your dog. And a really quick question on that note too is another thing that came up was, what's your take on Librela? As that's getting all of the hype too.
You might go doing that as a corner is the last one. Okay, so right, let me think. Let me get my words. Librela is anti-nerve growth factor. And it was brought to the market specifically for dogs that are suffering or have been diagnosed with osteoarthritis. So what Librela does basically is so the nerves that communicate pain in, say, the arthritic knee, it goes, you don't need to send any messages anymore. So the dog goes, oh, brilliant, I'm not in pain anymore. Woohoo. However, what happens, or what we've seen happen in human studies, so the human equivalent of Librela was part of a research program that looked at human patients with knee osteoarthritis, and it looked at the progression of joint disease over 10 years. So they were using the equivalent of Librela, anti-nerve growth factor, in humans for 10 years. X-rayed at the beginning, X-rayed at the end. And it got pulled from human trials. It was not allowed to go to market because what happened or what occurred was something called joint trashing. So if something is painful and you remove that pain, we have to remember that pain is a protective mechanism. What happens is, even us humans who have the cognitive ability to understand what we do on a Monday can cause pain on a Tuesday, joint trashing occurred. So the cartilage was absolutely obliterated beyond repair in the knee. So in humans, they were like, nope, absolutely not. We're not having that. So what the lovely zoetis did was they were like, oh, let's see how it works in dogs. I believe their study ran for, it was either 3 or 6 months. It was definitely under a year. And I believe it was either 8 or 12 dogs that we used in the study. So very, very small research group, surprisingly. And weirdly, no joint trashing occurred in that time period. because you know what, it wasn't 10 years long, so I'm trying not to be really sarcastic. So I went to a big convention, not going to say who it was, but there was a lecture about Librela from the creator of Librela, and guess who was sat front row before she realised what lecture she was sat in? This gal right here. He also co-created joint disease Hill's Food as well, so I was like, you know, nearly passing out on the front. I was like, why am I in this room? But when we don't agree with something, it is important that we still listen because it makes our arguments more robust. Okay. So this drug is being sold as the new NSAID. NSAIDs, we know long-term use can have liver and kidney damaging. It can cause liver and kidney damage, but it can cause digestive upset as well. So we know that, okay, with long-term use, we've got those three things to contend with. It doesn't matter how much money you put into research, the one thing you cannot buy is time. Librela was put out there. It has been sold as this wonder drug, as this silver bullet, the new NSAID. It is completely different to an NSAID. An NSAID is an analgesic and an anti-inflammatory. Librela is anti-nerve growth factor. That injection goes into the body. Do you think it goes, right, okay, let's have a look. Tick list. Yes, we're just going to work on that little bit of arthritis in the toe, that bad arthritis in the hip. It does not work like that. It will go everywhere, okay? So this is why we are seeing dogs itching after having Librela. We are having dogs starting with urinary incontinency. So when it's getting to that stage of life, one of the things is that when a dog starts going to the toilet in the house, the pet parents go, okay, that's the warning sign. Now it's time. Now it's time. When actually could it be a side effect of the drug that is not being popularly reported, right? With Librela, I'm seeing it dangerously prescribed. It's been prescribed before a paracetamol trial. Yeah, young dogs as well, okay? But it's the way that it's been marketed as the new NSAID. I do not think vets are out there to, you know, cause harm to dogs. You know, they've taken oaths to not harm dogs. They've gone, oh, injectable. This is super easy. I don't have to worry about patient compliance with taking drugs, and I can effectively take that dog's pain away. Tick, tick, tick. We have to remember it only works in 80% of dogs. And there comes a time when that drug doesn't work as effectively anymore as well. And we are still trying to understand that length of period of when it stops being as effective. Have I seen Librela do good things? I've seen Librela do amazing things. So I had little Cav, 12 years old, heart murmur, syringomyelia, arthritis everywhere. Poorly boy. She was doing everything nutrition-wise. She was doing all the supplements. He was having his therapy. He was having his gabapentin, his onset. She was doing everything. And it got to a point where we weren't just plateauing with treatment. We were seeing a decline because the disease was progressing a lot quicker. And she says, I don't know what else to do. And I was like, well, there's one thing we haven't looked at. And she's like, I'm terrified. And I was like, listen, you're going to have to make a decision at some point. Like, we either effectively target this pain now, or we have less time with him because we're not managing the pain effectively at the moment. I said, go away, have a think about it. It's all about making an informed choice. I'll support you, whatever you choose. And she went with the Librela, and the last 6 months of his life, they were comfortable. They were comfortable 6 months. So rather than have him go on for a year in agony, we had him 6 months more comfortable. So does it have its place? Yes. Yes, it does. When everything else has stopped working.
Yeah.
Would I use it with my dogs? I can't ever say never because I'm not end stage disease, joint disease yet. I think what I would say is that it's been dangerously prescribed as well with dogs that have neurological conditions. If a dog has ever had any history of neurological issues, they categorically should not be on Librela. It's in the data, it's on the safety sheet, but it is still being prescribed to dogs with neurological conditions.
Well, that's where you should demand of your vet. So I'm all about helping pet parents become advocates for their dog's health. Demand you see the data sheet before any
Absolutely.
medication. Ask
And you
to
don't
see
have
it.
to make a decision in that room. You can go, do you know what? I'm going to have a think about it. I always say to people, like, vet care is private health care. You're paying for an opinion. If our opinion doesn't sit well with you, you can go and get another opinion. You're paying for everything. Don't be pressured into making a decision then and there. Go, do you know what? I'm going to have a sit. I'm going to have a think about it. I'm going to come back to you in a week. That's what I said. So after an initial session with me, I go, treatment plan. Well, I'd recommend this, but don't feel like you have to book in now. Go sit, digest, think, and then we'll come up with a plan. I'm here when you need me, Don't feel pressurized to do it then and there.
Yeah. Oh, I love it. I love it. Thank you for that. I also wanted to point listeners to your beautiful book about keeping a diary of your pet's pain, because I'm a huge advocate for observing your dog, and I think that your book is beautiful for doing that. Can you tell
Thank
listeners a bit
you.
about it, please?
Yeah, absolutely. So I've wrote Your Dog's Pain Diary, a blueprint to monitoring a pain trial. Because I found that I was sending people off to the vets, right? Okay, we need to start a pain trial. And I was writing on scraps of paper, right? Okay, behavior, if we see this change, we know that it's working. Posture, if we see this, and I was scraps of paper everywhere, text messages, emails. I was like, this is ridiculous. Surely there's something. And I looked and there was nothing. I like things to be tangible. I like things to be in front of me. Someone says, go and print something out. With all the best will in the world, I'll go, yeah. And I'll just forget it because there's another 20 other things that I want to be doing at the same time. So I wanted something tangible. I wanted something that was hard wearing because I know I'm a thug and I want this book to survive in the kitchen with dinner bins spilt on it and the dog's food prep and da 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 da. So that's why I made it. It's like having me in that vet consult room with you, and we build up a picture of what pain looks like for your dog. You then can go to the vets and say, this is what I've seen in behavior, posture, gait, and capabilities. I would like to go on a pain trial. And every day you track, because we built the goals together, we track for 6 weeks. And then at the end of that, there's a summary that you can then present to your vet and go, here, this is what I'm seeing. I'm telling you now, the vet is not going to look through 6 weeks worth of notes. What they will do is look at that summary and either make a yes or a no. Because sometimes one pain relief might be, so like it could be an NSAID, really good for musculoskeletal pain, but actually you need a little bit of nerve pain medication in there to support. Sometimes you need a little bit of a cocktail, right? So it's about finding out. So yes, we've seen improvement, but I think we can do better. And that's where the book comes from, is to help support pet parents, because not everyone can come to me. I'm in Yorkshire, I'm in the middle of the UK, and it's just not feasible for some people to bring their dogs to me. This is like having me with you. So you can get it on my website, it's on Amazon, it's with my publishers, which is 5M Publishing, and you can also get it through Waterstones as well, which is a big UK bookstore as well.
Brilliant. And I will leave the links in the show notes so you can access them.
Thank you.
Yes, I could literally talk to you all day. I mean, this is so amazing. I wanted to ask you, is there anything that I've not asked you or brought up that you feel is important for listeners to know right now?
No, I think the main thing is pain is emotional and physical. Don't forget that. It's emotional and physical. And the only person that can determine whether it's painful is the being themselves.
Yeah.
The dog determines whether or not it's painful. Listen to them. They're telling you so much. But I've got loads of free resources on my website. Go and have a dig about on there. There's loads of bits and pieces on there to help you be the best pet parent you can be when it comes to managing your dog's pain.
Perfect. I will direct people to that. Thank you. I've got one last question that's specifically for you.
Oh, yeah, fly.
And so you'll know if you listen to the podcast that I ask all of my guests this. What have your dogs, or if you want to reflect on dogs in general, that's totally fine too. What do you feel like they have taught you about what it means to be human?
What have you taught? I'm just looking at my dogs now. You do the best you can with the information you have at the time. Yeah, I say that a lot to pet parents, and my dogs Snoopy and Penny are the reason that YPT exists, and I know they can see that wherever they are, I know that they know their legacy lives on. And I did everything that the vets told me that I did. I was full conventional. We're talking flea and worm treatment, vaccinations, the prescribed food. I did everything and I still lost my boy. I played by the rules and I still lost him. And it was through one of the hardest lessons I've ever had to learn that has taken me on this journey. But you know what? I did the best I did with the information I had at the time. I know better, so I can do better now. And part of that is just absolutely ramming the message down people's throat about canine pain and about species appropriate nutrition. If I can help protect someone else from the pain that I felt of losing my own dogs, then it's all for something, isn't it? You know?
Yeah. Thank you for that. Thank you
No,
for
you're welcome.
Oh, thank you for everything. You're just such a joy. I appreciate your time, your wisdom, your energy, and just thank you so much for this.
No, thank you for having me. I've loved it. Thank you so much.
We'll have to have you back.
You tell me when and where, and I'll be here.
Thanks, Yaz.
Thank you so much for joining me for my conversation with Yaz Porritt. If you want to learn more about Yaz, her practice, and her many offerings, check out her website, yorkshirepooches.co.uk, as well as her Instagram, yorkshire.pooches. I've left these in the show notes, along with a link to Yaz's pain diary and the book The Body Keeps the Score by Bessel van der Kolk that Yaz mentions. Now, what other topics would you like me to cover on the podcast to help you best nourish your dog and yourself, mind, body, and soul? Reach out and let me know. Again, you can find me on Instagram at Mystic Dog Mama, on YouTube, or on my website, mysticdogmama.com. All right, until next time.